Fibroids, everything you need to know. Uterine fibroids are non-cancerous tumors that grow from the muscle layers of the womb. These benign growths of smooth muscle can vary from the size of a bean to being as large as a melon. They are also known as leiomyomas and myomas. Fibroids affect around 30% of all women by the age of 35 years, and from 20 to 80% by the age of 50 years. They usually develop between the ages of 16 to 50 years. These are the reproductive years during which estrogen levels are higher. This Mount Knowledge Center article will look at the types of fibroid, their effects on the body, what causes them, how they are discovered, and what women can do to treat them. Fast facts on fibroids. Here are some key points about fibroids. More information is in the main article. Fibroids are most common during the reproductive years. It is unclear exactly why they form, but they appear to develop when estrogen levels are higher. Most people experience no symptoms, but they can include lower backache, constipation, and excessive or painful uterine bleeding leading to anemia. Complications are rare, but they can be serious. There are 4 types of fibroid. Intramural, this is the most common type. An intramural fibroid is embedded in the muscular wall of the womb. Subserosal fibroids, these extend beyond the wall of the womb and grow within the surrounding outer uterine tissue layer. They can develop into pedunculated fibroids, where the fibroid has a stalk and can become quite large. Submucosal fibroids, this type can push into the cavity of the womb. It is usually found in the muscle beneath the inner lining of the wall. Cervical fibroids take root in the neck of the womb, known as the cervix. The classification of a fibroid depends on its location in the womb. Symptoms: around 1 in 3 women with fibroids will experience symptoms. These may include heavy, painful periods, also known as menorrhagia, anemia from heavy periods, lower backache or leg pain, constipation, discomfort in the lower abdomen, especially in the case of large fibroids, frequent urination, pain during intercourse, known as dyspareunia. Other possible symptoms include labor problems, pregnancy problems, fertility problems, repeated miscarriages. If fibroids are large, there may also be weight gain and swelling in the lower abdomen. Once a fibroid develops, it can continue to grow until menopause. As estrogen levels fall after menopause, the fibroid will usually shrink. Causes: it remains unclear exactly what causes fibroids. They may be related to estrogen levels. During the reproductive years, estrogen and progesterone levels are higher. When estrogen levels are high, especially during pregnancy, fibroids tend to swell. They are also more likely to develop when a woman is taking birth control pills that contain estrogen. Low estrogen levels can cause fibroids may shrink, such during and after menopause. Genetic factors are thought to impact the development of fibroids. Having a close relative with fibroids increases the chance of developing them. There is also evidence that red meat, alcohol, and caffeine could increase the risk of fibroids, and that an increased intake of fruit and vegetables might reduce it. Being overweight or obese increases the risk of fibroids. Childbearing lowers the risk of developing fibroids. The risk reduces each time a woman gives birth. Diagnosis: as fibroids often do not show symptoms, they are usually diagnosed during routine pelvic examinations. The following diagnostic tests can detect fibroids and rule out other conditions. A doctor can create ultrasound images by scanning over the abdomen or by inserting a small ultrasound probe into the vagina. Both approaches may be needed. An MRI can determine the size and quantity of fibroids. A hysteroscopy uses a small device with a camera attached to the end to examine the inside of the womb. The device is inserted through the vagina and into the womb through the cervix. If necessary, the doctor can take a biopsy at the same time to identify potentially cancerous cells in the area. A laparoscopy may also be performed. In a laparoscopy, the doctor makes a small opening in the skin of the abdomen and inserts a small tube with a lighted camera. The camera reaches into the abdominopelvic cavity to examine the outside of the womb and its surrounding structures. If necessary, a biopsy can be taken from the outer layer of the womb. Treatment is only recommended for those women experiencing symptoms as a result of fibroids. If the fibroids are not affecting quality of life, treatment may not be necessary. Fibroids can lead to heavy periods, but if these do not cause major problems, one may choose not to have treatment. During menopause, fibroids often shrink, and symptoms often become less apparent or even resolve completely. When treatment is necessary, it can take the form of medication or surgery. The location of the fibroids, the severity of symptoms, and any future childbearing plans can all affect the decision.